Medicare Advantage Part D step therapy. Fascinating topic. It's a little dry. I hate to lead out with a lot of my topics are a little dry, but I don't want you to have unrealistic expectations that this is going to be super sexy and exciting, because it's not really, but you got to know it if you're on Medicare Part D. Sylvia Gordon with the Medicare Family. Our family has 3 generations of specialists in the Medicare market that are here to help you. We're talking about Medicare Part D step therapy today, which means if I want to get to my drug, I have to go up the steps. So I am prescribed a very expensive drug by my doctor. Doctors don't know what they cost. They don't care. They just pick a drug sometimes. You ask your doctor, why did you prescribe this drug? How many of you ever asked your doctor that? I was shocked one time when I asked my doctor, why did you prescribe this? And she said, oh, because I have a lot of free samples, so I was going to give you like a month free. That's the only reason you prescribed it? She's like, oh yeah, I can save you like a lot of money for 1 month. I don't feel like that was a really good reason for me to be on this drug, potentially for the rest of my life. So ask your doctor, why did you prescribe that? And then if you're comfortable with that answer, then you go to the pharmacy and you try to get it filled. And the pharmacy said, oh, sorry, we can't give you that drug. That drug is expensive. So then you might get irritated right there. I would be. And then you call your insurance agent. Sylvia, you told me that my insurance company covered this expensive brand name drug. They do. They do. I'll re-verify it. Oh, yeah, they do. Well, I just went to the pharmacy and they told me I can't get it. Not that you'd be all huffy with your hands on your hips, but we all know you probably are. So then I have to say, remember when we were going over your plan in January or whenever, October, and I explained that some of the drugs might have barriers to entry. Step therapy, and if you look at that formulary book, they might have an ST or an S behind it. That means you can get the drug if you go through the steps, which means you try the cheap generic, and if that doesn't work, then you can have access to the expensive brand name. Those are the steps. And you're like, I don't want to be the guinea pig on this. My doctor already said he wants me here. The insurance company's going to overrule my doctor? That's the indignation. Yeah. If you don't want the insurance company to overrule your doctor, you can pay for the drug. Straight up, it won't count towards any of your Part D thresholds. Okay, so now, if you don't want to be the guinea pig and you don't want to go through the steps, you can apply for a formulary exception, which would make you not have to do the step therapy. So you can apply for that. Medicare does have that exception. Or you can switch plans. It's a time when you could switch plan if you're a person in a state that's eligible to switch plans at any time, to go to a different insurance company that doesn't have that drug at step therapy. So chances are it's too late for you to mess with that. Chances are your choice is to go through the step therapy, because applying for the exception is probably not really gonna, but you can apply for the exception, or just pay for the drug. So most of you are going to go through the step therapy. So you want to know a little bit more about the step therapy. What are the requirements to the step therapy? And that is that you're going to have to be on the generic for several months, maybe 1 month, maybe 3 months, to prove that that doesn't perform as well as the brand name. So if you're getting the great results on the cheap one, that's a win for you, because you're not paying the high price for the brand name too. And to be truthful, a lot of times the doctors put you on a brand name because they're getting a little bit, I'm not supposed to say kickback, but they get something. I'm not supposed to say kickback, but they get something for prescribing so many of that brand name. If you don't believe me, Google it, because it's true. Okay? So your doctor's motivation at putting you on the expensive brand name might have some self-interest. I don't want to be bad to doctors, but that might be something that you might never take into consideration. A lot of us just blindly believe our doctors always have our best interests in mind. They don't know that, and you can look this up. I know the site. Ask me in the comments if you'd like the site, where you can see how many honorariums your doctor has gotten, which is basically, they say, we'll fly to the Bahamas for 7 days and your whole family, put you up at the Atlantis and the penthouse, as long as you submit a paper and talk for 20 minutes. So that's kind of like a disguised kickback that you get this $10,000 vacation for talking for 20 minutes. And I don't even know if anybody's listening to the talk or whatever. So trust me, this stuff's true. Your doctor might be fantastic. Your doctor might not. So it could be a win-win. The step therapy could get you on a cheaper generic for the rest of your life and save you untold thousands of dollars because the insurance company put that step therapy barrier in there. So let's just, that's a win for you. That's a win for the insurance company. The lose-lose is that during the step therapy part, the drug, and I hate to alarm people, but the drug can't control your blood pressure. It's got to be 24 hours of continuous control, and it can't do it. It can't perform as well, and that you could have something bad happen because your blood pressure spiked. So when we say that step therapy kind of puts you in a guinea pig situation, yeah, it could. I didn't want the video to get depressing, but when we're talking about your health care and we're talking about a for-profit system, it's not always that everybody's trying to do what's right for the patient. A lot of times they're trying to do what's right for the bottom line, and the patient could spike blood pressure and have stroke because they couldn't get this drug that their doctor really wanted them to be on, that their doctors had a lot of experience and really felt that this drug would be the one that was good for you. So thank you for watching. If it was helpful, let me know. If I was too depressing, let me know, and I will step it up next time. I try to be transparent, try to tell you what I'd want to know, try to talk to you like I talk to my clients, and I talk to them like I talk to my family. So some of those things I talked about was a little uncomfortable, and believe me, I get blowback from the drug companies, and they don't want me to talk like that. But this is all true, okay? And it's stuff you as a Medicare beneficiary, as a consumer, you need to make the decisions. Hopefully you are getting this education from your insurance agent. If you don't have a relationship with your insurance agent like this, that they're telling you the good and the bad and the ugly, we would love to work with you. Never costs extra to work with an agent. Email us, call us right now, the number's on the screen. Ask us anything you have in the comments. We're here to help.